gastritis, we all have an experience or some amount of experience with it. It's nothing new. Maybe the word itself might be a bit strange to person. But when we really break it down, it just simply saying that's inflammation of the gastric area, the stomach to be exact. Right? So tonight we'll be just exploring. It's an interactive moment where we look at some of the causes, um, the experiences, the do, the don'ts, how we can alleviate or totally eliminate issues of gastritis. Well, not only just for the festive season, but going forward. And in the same breath, we'll entertain questions or any concern which we'll be able to address within our purview. There's a slideshow, a very simplified one. I don't want to basically go through it just to give an overview, as to what gastritis is and what we should look for, or some of the things that we can do to try and prevent ourselves from going down that road of gastritis.
Um, when persons come to you and come to your pharmacy or come to you as a pharmacist and start to tell you that they're having start to think that this person might be having gastritis, or do you go through the questions?
Well, go through the routine question. I mean, the patient history, I mean, the duration of the pain, when they notice the pain, if they're on any form of medication, what they're on, and just lifestyle and everything. Right. But you find most of the time, a lot of people come, they mix up gastritis, or they have gas pain and all kind of pain. And it's due mainly to a lifestyle issue. A lot of persons, Jamaicans, love painkillers. A lot of them, they don't like the idea of even trying to find the real cause of the pain and try to get proper pain management. So they'll find themselves taking a lot of those NSAIDs out here, like the Advils and the ibuprofen, and that can be a bit dangerous for the stomach based on prolonged use.
As you just said that anything with high just an inflammation.
Right, and the gastro has to do with, just said in the preamble, has to do with the whole discussion. And gastric has to do with the stomach and digestive area of the stomach. Right. Right. So as I start, let us look at what is gastritis, right? It's a simple a condition which occurs when there is an inflammation of the stomach. And on the diagram here, we try to demonstrate what. An inflammation, as we say in simple terms, like a flame, something burning. And we also have some form of inflammation. I mean, you might have a little swelling in an area, you might get bitten by an insect, the area is red and swollen. That's an inflammation. So inflammation can occur pretty much in any part of the body. So on the diagram we're looking on the screen, we see where what a normal stomach looks like, right? The cell walls or the lining of the stomach is intact. There's no mark of any form of ulcer or anything like that. On the other side now, when you look at a stomach that is inflamed or is experiencing some form of gastritis, you realize that there's a thinning of the stomach lining, some damage is taking place there, and also there's a bit of a hole, what we classify as some erosion as an ulcer. So pretty much what that gastritis is, an inflammation of the stomach. That inflammation can be caused by a number of things. As we go further, we'll explore those things. And right now, we're at that area where we're looking at the causes of gastritis. They are not just limited to what is on the screen, but pretty much these are the predominant ones, right? So an individual may experience gastritis due to some common causes, such as a bacterial infection. And one of the common bacterial infections that affects the stomach, which can be contagious caused by improper sanitation, is the Helicobacter pylori bacteria, which is known as the HP bacteria, right? Also, excessive consumption of alcohol. Not just alcohol, but certain drugs like caffeine, right? Maybe certain citrus juice. I wonder why Dane is laughing. Also, we spoke about it earlier on, NSAID. These just mean painkillers, the one that used for pain and swelling, like ibuprofen and cataflam, Voltaren. A lot of persons are familiar with those, the Aleve and the Advils, right? Surprisingly, stress is also a contributing factor to gastritis and other disease conditions, autoimmune disease conditions like type 1 diabetes as well, can also contribute to gastritis. Um, the chat is open there. Right, so we'll entertain question at any given moment. You're monitoring, right? Right. Right. Let us look at who is at risk for gastritis. Is it that all of us are at risk? I mean, that could be our first poll question. At any given moment, you can answer it. Who is at risk of developing gastritis? All right. The answer, persons who smoke, right? Persons who smoke. And why would say persons who smoke? You know that cigarette smoke contains a whole ton of different chemicals, including the famous nicotine, plus a whole other set of other toxins, right? That itself can also affect the lining of the stomach wall, and hence the reason the person can end up with some amount of inflammation of the stomach. A lot of Jamaicans can attest to this. Persons who eat spicy food and acidic food in excess. As children, or adults, sometimes you might eat a June plum with salt and eat a portion. What happens at the end of the day? Stomach burns. Or you eat a portion of sour oranges, especially. Stomach burns. Or you drink some liquid that has a lot of, that is acidic plus contains alcohol base, like soy. If you consume a lot of soy that has alcohol in it, you will end up with some form of gastritis. Alright, also individuals who are experiencing high levels of stress. Stress, well, you know that stress can trigger any form of itis in the body, whether gastritis, right, or anything like that. We spoke earlier about persons who have certain disease condition where their immune system is compromised, right? These persons might have certain disease conditions like thyroid, issues with the thyroid, there might be HIV, AIDS patient, that things that affect the immune system. Persons who like cancer patients or persons with kidney disease, right? Those are some of the persons who are prone to developing gastritis. Is there any questions so far, Ian?
No question.
Okay. Anything you want to add based on your own experience?
Right, it's just, we're just wondering about the fact that June plum, can be an issue, considering that June plum is a fruit. And you'd want to think that if you're going to have stomach issues such as that, then you may want to avoid spicy foods or meat, some kind of meat and stuff. But fruits, I guess everybody would normally think that if you're going to be having that kind of issue, then having fruits would be the best way to kind of
true, but then the type of fruit, because some fruits are a bit acidic than others. So when you think about the citrus fruits, like the grapefruits and oranges, lime, and those things, they tend to can create that issue on the stomach because of the concentration of citric acid within them. And especially if the stomach is already susceptible, meaning that, the lining, the mucosa lining the skin, you already have some damage, maybe there's some erosion and infected by some bacteria, then you're more susceptible to such a thing. Spicy food, on the other hand, whether the herbs or just the pepper and so on that is used, is also a possible danger.
But just to touch a point on alcohol, we know that Jamaica has the largest percentage of bars.
Per square mile, yeah, just like church. I think there's a competition between the bars and the churches.
And so, I've seen a study that says that 8 in every 1,000 persons may have gastritis, and in what you just mentioned, in certain factors or risk factors, did mention alcohol consumption. And we know, because we have so many bars in Jamaica per square mile, then that would mean that we have a lot of persons who may consume alcohol per square mile. Yeah, right. Yeah, right. But so would that suggest then that a lot of the persons who may come to the pharmacy with these kind of stomach issues is because of alcohol consumption?
By alcohol consumption, right? And in questioning the patient and going through, you might pick that up, right? Some of these persons who consume a lot of alcohol might not be feeding themselves properly, the right nutrition, the right dieting, and so on, right? So you can imagine alcohol, which is a slightly caustic substance, and it depends on the type of alcohol too, right? And how you consume that alcohol. Right? If you're going to drink something and it's not properly diluted, I'd imagine, or and you have an issue with your stomach wall, and that imagine that alcohol going to your stomach, then we know the effect of alcohol on your skin, much less a sensitive area like your mucosal cells, right? So that is a factor that we need to bear in mind. So some of the symptoms that we can look for, if you're at home and you're experiencing certain symptoms, not saying that you should self-diagnose yourself, but at the end of the day, you should have an idea as to what might be happening to you. So when you come before your healthcare provider, whether you're the physician or you stop at the pharmacy at first, because you didn't think that it might warrant you sitting in an doctor's office and waiting for a visit. It could give you an idea, right? Nausea is one. Vomiting, right? It could be a possible cause of stomach irritation. Stomach pain, right? Which can be confused sometimes. Persons confuse stomach pain with abdominal pain, right? So you have to probe the patient a little bit more exactly. At times, ask them to demonstrate where exactly is hurting you, right? Burning sensation in your stomach. We get that a lot on a daily basis. Boy, I wake up this morning, I eat something last night, and from eating the stomach, now stop, burn me, right? Loss of appetite. Indigestion, right? Acid reflux, those things. People come and say, eat and lay on last night, and everything just coming out of belch, burn like pepper, the throat and all those things, right? Those are possible signs of gastritis, right? And sometimes you can zone in on it with the questions that you ask. What eating late at night, the type of food they eat, right? What medication they're on. It can give you a good picture as to that person medical profile, whether that be a good screen for gastritis. Anything to add?
Yeah, I was going to ask you. We did mention that maybe eating late at night would be some of the concerns when it comes to persons experiencing gastritis. And we did mention also earlier that if you, it's really due to acid buildup in the stomach, right? So I guess some persons may say, or it will be easy to deduce that if acid buildup in the stomach and you want to get rid of that acid buildup, then the best way to do is to eat food, right? So if you're eating late at night or just before you go to your bed, wouldn't that counter the acid buildup in your stomach in the nighttime?
Man. Part of the thing, remember, the digestion, if you remember the whole anatomy and physiology of digestion, it starts from the mouth, goes down to the stomach, and then straight down to the small intestine. If things are going down, I'm just imagine, and you are in an upright position, then you get the aid of gravity one, and so it will easy access for the thing to open. If you go and lay down and 180 degree on your bed, there'll be a natural tendency for things to flow back up, right? And that's not healthy. I mean, even your stomach need rest, so the time your stomach should rest is you're working, right? And these habits over a period of time can cause an issue. They can even affect the emptying of your stomach. So you realize that people tell you, I'm not eat for how long, and stuff not going down, right? So healthy habits include not just eating, but also the way you go about eating at the time of the day when you consume your meal.
So therefore, so no snacking in the night.
Yes, I'm not being common. If you're hungry, you need to eat something, but I would expect in the middle of the night you plan to lay down the next half and eat some yam and banana done with chicken or something heavy like stewed pork. It's not just not healthy. Right? And that itself can create indigestion. Remember that one of the symptoms of gastritis is indigestion. What is indigestion? The inability to digest. Right? So if you're in a lane, if you're laying down flat on your back or your stomach, then the food will regurgitate naturally. Alright then, so now we have looked at some of the causes of gastritis and persons who are susceptible to gastritis. Then is all gastritis the same? I would imagine no. Right? So we just look at a few the different types. Right? So you have acute gastritis, right? That is just a sudden onset of severe inflammation of the stomach lining. Sudden. So it's saying that prior to that you did not have it, hence the reason acute. You also have chronic, which is the opposite, where the inflammation of an individual stomach lining has been present for a prolonged period of time, right? Then you have the erosive gastritis, the erosion, erosive, wearing away, washing away, being apart. And this type of gastritis is an inflammation of the stomach lining, which has led to an erosion or damage that causes stomach ulcer or bleeding. Right? So, many times in the pharmacy, people come and say to you, say, boy, never ulcer, never been formally diagnosed. Oh, because we have this burning sensation when we eat and all kind of things, we can't hold on nothing on this. They might be correct. Right? But we don't encourage patients, listen, you don't stay home and self-diagnose yourself. As soon as you start to experience all these signs and symptoms that we had earlier on pointed out on the screen, I go back to them just now, which include nausea, vomiting, stomach pain, burning sensation in the stomach, loss of appetite and indigestion. If it's occurring too often, you should definitely seek medical attention, right? Because there could be something a little bit more than what you think. Because despite the fact that we might have the different types of gastritis. Well, if it's chronic, I mean, you've come into the pharmacy, you can probably, with a little lifestyle changes and a little over-the-counter stuff, or even go to your physician, can eradicate that. But the chronic one, though, that's the danger one, that you need to nip it as soon as possible, because that can lead to further erosion of the stomach, which we classify the third one as erosive gastritis, which is what we know as ulcer, which basically, if you were to look back on the diagram in the stomach, if you notice that this diagram, using my finger to point, there's a little crater there, that's known as an ulcer. That's when the thing is completely eroding, so the area becomes raw. So look at an ulcer, and if you get a cut, something hit you, you know that the area feeling inflamed, you can see that it is red, but then that's red. But you get another cut, or you further now, you get the same red area, and it catch on something, on a wall or something, and then the skin start to come off, and the area gets red and look raw, and they say require dressing, right? That's what is similarly happening into the stomach when you have an ulcer. Their cells are exposed, and one of the dangers about you having a raw area in the stomach or an ulcer, just imagine the acidity of the stomach. With that acidity of the stomach, because the ulcer normally forms with a protective layer around the stomach, which is the mucosa cells, when it has been eroding, starting to touch that thing. No one would want to imagine the pain and agony that a patient will be going through with such an insult. So it's important to also have a good, healthy stomach, right? So now we have looked at the different types of gastritis. Let us just recap quickly. We talk about the acute, which is just a sudden inflammation. So you just wake up one night and find stomach or burning or they have crampy feelings. Oh, it could be something you did wrong the night before. It could be the beginning of something else, right? You have the chronic one, which we get a lot of these things, where persons just consistently going to the doctor, getting all these PPI and antacid and stuff, and not getting anywhere, right? Not to bash any physician, but sometimes, I don't know if it's a lack of insight, but sometimes I find that at some point the patient should be referred to the specialist in that area, because if the same thing over and it's not really working, then you should find an alternative, right? And then lastly, the danger one, which leads to bleeding and erosion of the stomach, which we call ulcer. All right, any input?
Yeah, I was wondering, there's a myth amongst us that if you're having stomach problems, then you should drink a box of milk,
Right.
right? And so that that myth that we have in Japan that to drink milk. I mean, what do you have to say about that? Because does milk really help? Is it for the better or for the worse?
Personally, I don't even know if it's a total myth because as a child, I've seen patients having stomach issue and drink the milk. I've seen it in my household like, growing up as a child. And my mother have an issue and she drink the milk and it help. I think there might be some logics with it, I'm not sure. I know milk overall acts as a soothing agent. So if you get burned after you just pour milk over it, it can help, right? As to the chemistry, I probably need to get myself up to date with that. I think what the milk does is just act as a soothing agent.
Right. So in effect, then we call it a counter irritant. Then.
A counter agent. Right? Like a
Um,
soothing
yeah,
agent.
yeah, I really like counter, but not necessarily a curative.
No, it's not.
It's
No,
not
it's
a
not.
curative.
Definitely
It's
not.
not a curative. So you find that persons with, well, if just drinking milk may not necessarily fix the problem, but if I say to you that if you drink this, you will get better, automatically before you even drink it, you start to feel better already. So, and that happens a lot. Um, in terms of, you know, the chronic versus the acute situations. Persons who are in a chronic state, um, what kind of treatment would those persons get? I mean, let's say look at it in a different way. In that the acute case, you may run and come to the pharmacy, you know, but in the chronic state, then you definitely need to get to see a physician. But how do you differentiate between the chronic situation versus the acute situation?
Well, I mean, from where I sit or stand in the pharmacy, you look at the frequency of returning patient with a similar complaint and mentioning the same thing over and over. And consistently, you have to intervene. I mean, our role as pharmacists is to intervene, and where we can add our expertise, we do that, right? Whether from the patient level or suggest to in terms of the medical team around that patient, right? We probe the patient because it could be initially started out as a chronic situation, but due to the patient's lifestyle, it's just not getting better. Because if you definitely have an issue with gastritis and you constantly eating those food, consuming those alcohol, that is a no-no that can actually propagate the effect, then naturally you will get no result. So you take the antacid now, you take your stomach tablet, as we say, um, for a second, and it helps. But tomorrow morning you go back to doing the same thing. So what I realized then, what I would say, distinguishing between the chronic and the acute state of gastritis is that most of the time patients do not stick to their medication regimen, right? One, they do not alter their lifestyle, right? So they believe, and sometimes we are guilty of it, because I know patients who have allergic reaction or who are lactose intolerant. And they say, "Boy, pharmacist, eat some ice cream, give me something to eat some ice cream on birthday or a stomach issue is a special day or anniversary and I need to drink a little bottle of wine. I'm going to drive down to Ochi weekend and can't go there and drink nothing, right? So we all guilty of that at times, right? But I think the issue is when we ignore the science, just using that band-aid effect, right, and not sticking to the therapeutic regimen to help to alleviate the problem. So how can we prevent gastritis? Can we actually prevent gastritis? I mean, it's not a end all. It's not a terminal illness. Yes, it's just an inflammation. It's just an inflammation, right? But it can be a big inflammation. So here are some tips, especially for the festive season. And why we mention this, gaining his wisdom and continue to educate his patient. I mean, I think it was an appropriate topic because persons at times, more food is produced at that time, provided at that time. That's factual. Um, The availability of food is there also. Plus, the possibility of persons consuming stuff that they don't generally consume throughout the year, or maybe consuming for the first time, right? So one will get carried away naturally, right? Where freedom exists, it is folly to resist, right? Right? Right, I'm not talking about the 31st. Right? So, so persons will consume. And in this time of at the time of the year, persons will tend to eat fast too, because you need to capitalize, get in as much. Person will tend to consume a variety of alcohol. Maybe throughout the year, you usually drink rum and boom. No, your uncle come from overseas. Any. Ciroc. Right? Red Bull, you usually drink boom. Now you start drinking Red Bull. So these things naturally, sometimes your body might just reject it, right? Right, but on a serious note though, but how can we help to prevent or minimize gastritis? One, we can eat smaller portions, right? Eat more frequently. So instead of eating this big wok, as we say in Jamaica, no, split it up. So in a sense, right, you don't put so much pressure on your stomach at any given time, right? Because that's the season for temptation. I've just alluded to it, where you want to get carried away, right? Try to avoid too many spicy, fried, or acidic food. So if you're going to eat food that there's an option to consume it without it being fried, whether you fry chicken, well, use your air fryer, bake it, steam it, jerk it. You understand? Those are other options, right? Fried food, minimize it because the oil itself, right, is a factor when it comes to persons with gastritis, and the acidic foods, cut down on them as best as possible. Other stuff you can do include more fruit and vegetable as often as possible. This, I'll put an asterisk here. As we mentioned, some fruits and some vegetables are acidic, right? So we need to find the right ones, right, and eat them in moderation. Incorporate fiber-rich foods like your oats, your flaxseed, right? Your vegetables, right? Reduce excessive smoking and alcohol consumption. And these are just fitting for the festive season. Who might never smoke based on the vibes and they're going to think, might take a draw. Who never normally drink, definitely going to drink. And more people, you find more people getting drunk during this time of the year. Young people, Christian, non-Christian, getting drunk. Right. I think I need a right? So we reduce the alcohol consumption and the excess smoking. Engage in relaxing activities. Because remember we said earlier on that stress is also a contributing factor to gastritis. So anything to minimize or reduce your stress levels will also help in reducing gastritis. If possible, we spoke about pain tablets. When we talk about NSAID, don't worry about, for those who know that funny looking word, NSAID. It just means a type of pain tablet. Those pain tablets that deals with inflammation, right? And we mentioned before, the Cataflam, the Voltaren, the Aleve, the Advil, right? Those can contribute to inflammation of the gastric system or your stomach, and excess of those. So minimize those. And if you have to take them due to chronic pain or chronic inflammation, I'm certain your pharmacist and the physician will give you something to protect or minimize that effect on the stomach, right? Wash hands frequently. In a sense, practice proper hygiene, because remember we spoke about not only does the food and medication can cause gastritis, and the alcohol and the smoking and the caffeine. There's a particular bacteria, the H. pylori bacteria, which can be had by you touching things and having a place in an insanitary manner. Anything from you, Sir Thomas?
Yeah, definitely. We're just talking about preventative measures, okay? And we did mention about certain foods, because we know that foods are certain factors, as one of the factors that may influence inflammation of the stomach, which we call gastritis. also you did mention the consumption of alcohol and so on, right? But is there any prophylaxis, meaning is there anything that you can take as a pharmacist? You know, you would like to recommend stuff. Is there anything that we can do that would prevent? Would you say drinking more water would help to to control those issues?
Universal solvent, meaning that it's that one liquid that a lot of things dissolve in, right? And not only that, but it's consumed. As consume, we consume water, and our constituent in the body, large amount of it is water, over 75%, right? So drinking water definitely as a diluting factor will help to minimize the acidity of the stomach. That's one. And it can also act as a soothing agent, right? So that's a very good point. So, for example, if you are consuming alcohol, as Dean mentioned, alcohol, don't just consume just the alcohol. Intermittently consume water. Afterward, consume water. That definitely will work. And I'm sure some of us have consumed. I don't know if you consume alcohol daily, but you probably tried that before and it works, right?
What I would say, I drink water, and you know, as you just mentioned, that water is the universal solvent. So anything that we drink does have water in it, right? So we leave it right there.
I was talking about an excess amount of water, undiluted water, right?
But I'd like to ask a question though, which I guess a lot of persons may even want to ask. Um, so let's say, for example, because we do mention that spicy foods and all that can be an issue. If I am a vegan, am I prone, or would I get gastritis? Or am I prone to getting that that kind of problem? Would I get stomach inflammation? Remember, I'm not eating any kind of meat. I'm not eating anything spicy or anything at all like that. I'm just eating fruits and vegetables.
You could be a vegan and they consume a lot of alcohol. You could be a vegan and they consume a lot of caffeine. You could be a vegan and they are addicted to painkillers. You could be a vegan not practicing proper hygiene and you contract the H. pylori bacteria. So I don't think it eliminates your lifestyle, whether or not you consume meat or not. Some vegetables and some fruits are acidic in nature, and if consumed in excess, then that itself can be an irritant to the stomach, and person can end up with gastritis. Um, what you probably intend to say, or maybe along the line you're thinking, is that um, you wouldn't be able to get gastritis from spicy meat because you're a vegan, but you might get it from spicy eggplant or spicy pumpkin. I don't know, spicy tomato, right? What is important, I don't think, is the material. The food substance is the additive, the spice.
Yeah, I guess as a vegan, I mean, I may practice, I may have certain kind of practice, so I might not be drinking any alcohol at all. But just to just make the point.
It just come to my mind. I don't know it come. I've never thought about it just yet. And it's a question I want to ask. The first person to answer this question, I'm going ahead and speak for Dane. They'll get a gift voucher for this Christmas for 2,500. It can come at any time. It's valid until March 2025, right? Why do persons in Grenada, why are persons in Grenada prone to gastritis? It just came to me. I don't know.
Can I answer? I would like to answer that question because that's easy. That's an easy answer.
Excellent. Are there any questions in the chat or any concern, anything that they want us to elaborate on or to repeat?
Somebody just said that them not talk to me, them not talk, because of late eating. So the person apparently is eating late right now, and that's why they're having this stomach problem. But yeah, if you eat late, you're prone to two things. One, stomach problems, or that is the gastritis, stomach inflammation, and two, you're prone to gaining a lot of weight. I mean, so be careful of how late. But Only if you want to gain weight, then I would say, yeah, you can maybe eat a bit late because the stomach won't metabolize the food.
Too much the late eating is issue, is after eating what you do. Because if in the night, most persons are inactive to a point, you understand? So if you just come in tired from work, which, I mean, that will happen at times, and you're hungry. If you're hungry, I'm not going to tell you to go to your bed and don't eat anything. But you probably just need to choose what to eat. I mean, right? All right, guys. So now we talk about gastritis, the causative agents, those who are prone for gastritis, and some of the things that actually kind of result from having gastritis. Now let us look at some of the treatments for gastritis. Right. Some of these treatments include over-the-counter stuff. Others are prescribed items or medication, right? And the treatment is dependent, one, but let me just bring back the slide to the different types. So the treatment is dependent on the type of gastritis. So if you're having an acute gastritis, the treatment would naturally be different from a chronic or the erosive one that normally is caused by some bacterial infection. Right. So the treatment include antacid. That a lot of Jamaicans know these antacids. The famous, not promoting any brand here, but the famous Dica, Relsa, New Gel, etc. These are some of the antacids that we come across in Jamaica, whether they're in the liquid form or in the tablet form, and in recent time we find them in the sachet in a, what do you describe that now? Not powder, in a gel-like that you can just, pull from the sachet, right? They're the more sophisticated treatments. Those are the ones that your doctors will prescribe, and we call them proton pump inhibitors. Don't get caught up with that. Basically, what these do is just prevent or minimize the formation of acid in your stomach. And some of us are patients and would know online the pantoprazole, Pantecta, Lanzaprazole, Omens. These are just a few, to name a few of those protein pump inhibitors. We also have the H2 receptor blockers, right? Guys, don't get a bit perturbed by these things for those who are not familiar. They're just that the stomach lining of the lining of the stomach, there's a certain mechanism that release the components that form the acid in the stomach. The acid is actually HCl, hydrochloric acid. So what these things do, they attack the process at different points, right? So some prevent maybe the release of hydrogen, so it won't be able to form the hydrochloric acid. Others might prevent the release of the H at some other point. So it's just basically affecting the whole process of acid production, right? So you have different areas along the process. So whether it's a proton pump inhibitor or the H2 receptor blockers, don't be caught up with that. The important thing is that treatment for gastritis have different approach, right? It can be from an antacid, it can be from a proton pump point of view, can be from a H2 block receptor, it can be a combination of all those. Also, antibiotics can be involved, right? When do antibiotics get involved? When there's some form of infection, right? And it's a biotic. So bacterial infection. Remember earlier on, we said that one of the causative agents of gastritis is the H. pylori bacteria, right? Which normally you can acquire it from improper sanitation, not practicing good hygiene. So if that bacteria is in the stomach, it has the possibility of feeding and eating away the stomach wall. So one of the things that your doctor will do, if suspected that you're having that condition, you'll be given a course of antibiotics, right? Normally for over a 2-week period. And an example of some of the antibiotics that are given here will be a metronidazole, the amoxicillin, clarithromycin is there. They don't use tetracycline anymore, so it should be clarithromycin, right? And that treatment is known as a triple therapy, right? Why triple therapy? 3 things are involved. 2 sets of antibiotic and a proton pump inhibitor. So it could be Pantecta, Pantoprazole, or Lanzap, or Omeprazole, right? And it is normally given for a 2-week span. The intent for that is that within the 2-week span, you should clean up majority of, if not all, of the H. pylori bacteria that is within the stomach. Normally, when that is done, a test is done after just to see where you stand. But you should see some improvement after. And after the 2 weeks, they'll continue with the proton pump inhibitor to continue the process while the healing process takes place, right? This is important. So you might go to your doctor over a period of time with a recurring gastritis or issue with the stomach, and then at some point you go to the pharmacy and you get a fairly decent bill and you say, oh, my bill is so expensive. And the person you're going to take this antibiotic for 2 weeks, this antibiotic for 2 weeks, this stomach tablet, as we say, just for simplicity, for 2 weeks. And you say, why? And you'd have to sit, as what we do all the time, and explain to the patient that there's a high possibility that the doctor is treating a stomach bacteria. And that stomach bacteria has the potential to erode or to create damage to your stomach wall. So as a means to stop it, slow it down, this is a therapy that is given. Right? Any question, Dean?
Yeah, I just want to also add that as part of the treatment too, that there's also the stomach coaters, those that use to coat the stomach. So you have something like sucralfate or alkagant, which is what is used to coat the stomach because um, while you want to block acid production, you also want to coat the stomach if there's any damage that are damage to the stomach lining. So therefore, if you get something to coat the stomach, then you know it's part of your treatment that the doctor may recommend for you. So while you may get an antacid, which is the antacid, as the name suggests, is counter acid, it's against the acid, then you can get something to coat the stomach, which is coat the lining of the stomach. And then you also mentioned about what we call the proton pump inhibitors, which is another part of the treatment, which basically just in layman terms inhibit the production of acid, really, or slows down the production of acid. And then to add the antibiotic to it, the antibiotic primarily is to, if there is, yeah, is to get rid of the H. pylori. So in some of those cases, is what we call a quadruple therapy. So you may get a triple therapy, and then you may get a quadruple therapy also. But these are just some other, ways of treating. But are there any vitamins that you can use also?
But not to cut it in, I've seen in recent times the introduction of probiotics in the treatment, right? In particular, the Biogia, I don't know how you pronounce it, and the Enterogermina in part of the treatment, right? You were asking if there.
Yeah, I was just about to ask about the use of, because everybody want to use herbal stuff these days, and you want to use maybe other ways of treatment other than just the pharmaceutical way. Is there any vitamins or is there any supplement then that you can use or that you can take to treat or help to prevent the inflammation of the gastric mucosa?
Off the top of my head, I'm thinking that we have supplements like enzyme supplements, like the papaya, that is good for digestion and so on. I'm thinking also activated charcoal is something else that I think as a potential value there. Um, Supplement the stomach lining and stuff. I can't directly think of any other thing, but what I do know is that the over-the-counter probiotics, those are excellent. The what you call it again, the lactobacillus. It's a couple of there, right? So, I know there's a particular brand out there that has a 10 billion one. There's one out there that has a 25 million. Yeah, so you can choose. It depends. Ask the pharmacist. And I must add, ladies and gentlemen, to our viewers, that Gateway Pharmacy, if you're ever in doubt, Gateway Pharmacy is a pharmacy where information is free. Your friendly pharmacist will spend the entire time trying to explain to you. And not only that, what is important, the availability of products. So all that we have said about gastritis, and even in the conference yesterday, sexual health, Dane is the man. when it comes to sexual health, right? He can fix you, especially for the festive season, right? Don't allow gastritis plus ED to get you down. Then it's the man.
All right. Just to just to add, I mean, we're talking about gastritis tonight, of course, and there's a fun question that we had yesterday is because we're talking about what you eat and how often you eat and so on and so forth, right? If you go home in the night and you say you're going to have a snack, or let's say you want to have something light, and you eat, yeah, and you eat bun and cheese, right? Would you consider bun and cheese to be a snack or a meal?
Then a meal is a snack, but it depends on the type of the size of the meal. So a snack is a light meal. So a snack is a light meal, right? Normally consumed in between meals or at a moment when it's not convenient to have your main meal, right? So a bun and cheese could be considered a meal. I mean, when we were going to school, I even know we have bun and cheese for lunch.
I mean, the question is, that we know that a meal is a snack, but in Jamaica, a meal is breakfast, lunch, or dinner. Okay, that's a main meal. So, would you consider bun and cheese to be one of your main meals, or bun and cheese is one of your main snack?
That's for the audience. Uh, it varies. At times, it can be my main meal as well as it depends on the occasion, my snack. I'm not sure I understand. If the only thing you consume for the day is bun and cheese, depends on the quantity of bun and cheese. We agree there are persons who just don't cook their meal. Huh? Wait.
All right, no problem. We can continue, but somebody's asking in the chat, how can gastritis be diagnosed?
Gastritis, naturally, anything to do with diagnosis has to do with your physician, right? It has to do with your physician. But we as pharmacists, we have a trained eye for these symptoms and conditions. So we can actually, what do we say, a good hypothesis or a good assumption based on the symptoms that present itself. These symptoms that we mentioned earlier on about nausea, vomiting, stomach pain, burning sensation in the stomach, loss of appetite and indigestion are not just solely unique to persons with gastritis, but it's a good way of zoning in to the possible cause of gastritis. So the best way to diagnose gastritis, you presenting these symptoms, going to your physician, carrying out certain tests, depends on the nature of the potential gastritis. If the symptoms are acute, chronic, right, then from that point, then the doctor can rightfully deduce that it's gastritis. But because it's an inflammation, I mean, you can say as a pharmacist, I suspect that you might be having gastritis based on what you present. And if you suggest something that is in like an antacid or something of that nature, and it helps within a short period, then at some point, I guess you could, rightfully conclude that that person might have had gastritis. Did you get any answer for the spice question? All right, let me ask again. Why is it that persons from Grenada are more susceptible to gastritis? Right, and the first person to respond via the chat will get a gift voucher valued at 2,500 courtesy of Gateway Pharmacy, stock in the heart of Mandeville, right in front of Mandeville Primary School. And that voucher will be valid until March 2025. So there's no need to rush to get it now if you are far away. That voucher will be, the validity of it will be until March 2025. Right, so in wrapping up, guys, we'd want to do a recap as to what is gastritis. Because guess what? At Gateway Pharmacy, we're not just here to sell products, but we are just here to educate. So, as they usually say, an educated patient is what?
Better patient.
A better patient. And we all agree, right? So, let us summarize what we have said so far. What is gastritis? In simple terms, it's just an inflammation of the stomach lining. And if you look on your screen, you see like the stomach to your left, it is on fire, right? It's just indicating that it's inflamed. We look at the causes of gastritis, right? We look at the fact that excess consumption of alcohol and caffeine can contribute to gastritis. Also, the excess use of painkillers, which we call NSAID, for example, cataflam, ibuprofen, can cause gastritis. Stress, some autoimmune disease that are disease that does appear from within, like type 1 diabetes, can contribute to gastritis. Also, certain bacterial infection of the stomach wall can contribute to gastritis. Who are at risk of developing gastritis? Persons who smoke, persons who consume excess alcohol, persons who are highly stressed, persons having certain autoimmune disease conditions such as certain thyroid issues and HIV/AIDS, kidney disease, liver disease. What are some of the symptoms of gastritis? All of us at some point in our life experience at least one of those symptoms, right? At times, we attribute it to other stuff because we might have a little stomach cramp and pain and we say, I guess may have because I never eat for morning, we need some ginger tea, right? So some of the symptoms include nausea, vomiting, stomach pain, burning sensation, indigestion, and loss of appetite. We also look at 3 different types of gastritis. We looked at acute gastritis, which is just a sudden onset of pain or inflammation in the stomach lining. We look at chronic gastritis, which is a more prolonged state. And we look at the erosive gastritis, which can lead to damage in the stomach wall or damage to the stomach wall, which can cause ulcer, which can cause bleeding, right? Which is one of the most dangerous forms of gastritis. How to prevent it, especially for the festive season, we say, listen, eat small portions at a time, eat a little bit more frequently, chew your food properly, that's important too, minimize alcohol consumption, drink plenty of water, increase your fiber intake, your fiber-rich foods, like your legumes, your peas, your beans, your vegetables, your oats and your flaxseed oil, those things, right? For those who are highly stressed, try to find means of de-stressing, do things that are fun, reduce your stress level, right? For persons who are addicted to painkillers, if the pain is more than you, ensure your physician give you something to protect the lining of your stomach. And if you can find alternate means of angling the pain, you try to do that, right? It's important. And also, we should always be practicing proper hygiene. Some of the things that can be used to treat it, we already know. The antacids that we come and pick up off the shelf in the pharmacy. Some of those medication that sell over the counter. Even some of these protein pumps are over the counter at a reduced dosage. Like you have Prolosec overseas. Prilosec, right. Prilosec, sorry, Kidane. Overseas, you have, we don't have no longer have it in Jamaica, like your Zantac and your ranitidine. I have seen omeprazole over the counter in some jurisdiction, right? So these are things that your doctor can prescribe for you, right? Antibiotic for those who have the dangerous bacterial infected stomach lining, right? So pretty much, guys, gastritis is not a death sentence, right? Whether for the festive season or after or before the festive season. The truth is, with a little discipline, you can manage it, right? And I will know this is a season for fun and be merry, and we're just putting out the information there. We're not saying that you shouldn't have fun. We're not saying that you shouldn't consume a little more than average. We're not saying that you shouldn't drink some of the alcohol that your uncle bring from the States. We're not saying that you shouldn't consume the soil or put alcohol in it. But drink it in moderation. Don't drink a big whack at any given time. Pace yourself, right? And consume water in between. And if you know you're susceptible or prone to stomach issue, get your stomach medication, the ones that will protect your stomach. Take them so that at the end of the day, come the 20, when the festive season up, come the 2nd of January, you can welcome the new year with fresh new stomach. No sour stomach, no indigestion, no belching around here, no cramps, no pain, no burning sensation. And I believe you can do it. And any question you have, you can shoot the question by calling Gateway Pharmacy or their social media handle. They're on Twitter, Instagram, Facebook, right? X, formerly X, no, formerly Twitter X, sorry, right? You can find them. And Dane is at your disposal, right? He's always available, right?
Just a quick question also, as you mentioned, we just did a recap, but we still have a question here. How, I mean, the symptoms of gastritis, how long does it, in terms of duration, how long does it normally happen for? Because you want to start the medication, but is there an expected time that that you should start feeling better?
Well, that's a very difficult question, Dean. But for persons with acute gastritis, in a few hours you should get some relief, right? I mean, naturally, those with chronic would take up a period of time for that thing to work in, because there'll be some with a damage there that need to be, repaired or healed. Not to mention those with the erosive gastritis. That definitely will happen over weeks into months. But as they go by, sticking to the regimen, also making the lifestyle changes, you will see improvement.
I know there are some persons here who are in the. You might know, you might have a relative, or you might be in the chat, or you might be in the on the live, whereby you might be taking like 5 or 6 different medications, right? We know that the stomach cannot. I mean, the stomach is big, yes, but when you put a lot of these tablets in your stomach all at once, I mean, what is the possibility of developing inflammation of the stomach, and what is the best thing to do when that happens?
There's a high possibility, and hence the reason for persons with polypharmacy, meaning that they're taking a lot of medication, right? There's always something there to cushion, to coat, to minimize any form of gastritis, right? That's a given. That's a protocol in treatment, right? So as a pharmacist, if you see a prescription and it has the potential to create that issue, you rightfully should intervene, right? If it's that they can't get through to the doctor, they might suggest something over the counter as a quick fix, or to help balance off that issue. But we should intervene, and it should be a given.
And another question that I'm sure persons are thinking about is that during this time of the year, that you might, we know we mentioned the old fact of alcohol consumption, but is it that you should not consume alcohol at all, or is it that you should consume less alcohol?
But what I find, I do consume alcohol at times, right? There are certain alcohols that tend to trigger or cause gastritis. It has that tendency quicker than others. So, and how you consume alcohol is also, there's an art in consuming alcohol, right? The type of alcohol. The truth is, the cheaper alcohols tend to be a little bit more at risk in having gastritis. I mean, I would say water is important. So instead of use a Red Bull, which is very tangy and acidic, right? You probably want to use water to chase your alcohol. You probably want to sip your alcohol instead of just drinking it fast. You can know you probably would want to eat something before you consume alcohol, right? So things like those, because even food itself can act as a cushion, as a protective barrier for, for alcohol consumption. So small portion, what I would suggest, small portions at a given time, sip your alcohol. You understand? Allow it to feel it, right? Consume water in between. If possible, you can consume something, whether nuts or some finger food in between. Um, the type of alcohol is important, right? So you know yourself. If you are a seasoned drinker, then you know what's good for you. If you are a first-time drinker, I would ask you stay away from high percentage alcohol, like the white rums, the Appletons and those things. Probably want to drink something mild, like wine, a sorrel beer, or even normal a Heineken or something of that nature, a Corona beer, something of that nature, right? While consuming water in between. I would suggest it on the rocks.
Um, the process this so what the Spice Island because well yeah well I yeah maybe it is that's the reason. It is Grenada's called the Spice Island for no reason at all, and it's because they have a lot of nutmeg there, so that's why they call them the Spice Islands. Uh, all right. But is are there any concerns? Are there any questions for those persons on the live? You can, we're gonna give allow for another 5 minutes if you want to ask any question or send any question. We're quite okay with that because we're here to give you that information. Um, we did have a pretty interactive discussion yesterday, I guess, because the topic was one in which affects everyone, and now we had on a different topic. So, but nonetheless, we're here to address your concerns, and any question that relates to your stomach. Remember that everything that you eat goes through your stomach, and so you have to ensure that you have good gut health. If you don't have good gut health, then I mean it will affect the rest of the body. So if you don't take care of the stomach, then that's where the problem will start to happen for you. So we're still going to allow for another 5 minutes for you to think about any question that you want to ask, and we'll address it. So let's see if anyone has any concerns, any question. Um, you know, we are aware that, and I know that a lot of us, eat these spicy foods, and we drink um, a lot. But you know, are there any myth that you hear about? Especially, we know that if your stomach feels sick, the first thing you draw for is some ginger tea, or you draw for some turmeric tea or mint tea. That's what you normally go for, and that is quite fine because I mean mint tea is good to have. Um, but what do you put in it? Sugar can also trigger some issues when it comes to the stomach. If you put too much sugar in your tea, so that can trigger something also. You know, so you know, is it a case whereby if you eat too often, would that trigger some some issues as regards to the stomach lining? Because you know that each time you eat or each time you think about food, the body automatically starts to produce acid. You know, so therefore it prepares the body, the stomach for food. So therefore, if you are eating a lot, then you are going to you may have a stomach issue going on. Um, I have a question here. It's a combination of dietary. Is there a question there? Oh, the answer. Okay, 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 okay. Okay, I understand what you're saying now. Yeah, yeah, I understand. Right. So, mhm, for look about the pylori infection. No, not necessarily. No, no. Mm-mm, mm-mm. Okay. So we can collect their information after. All right. All right. All right. So, seeing that there are no questions or no concerns, then what we'll do, we'll close off for this evening. And I thank all of those who were able to come on live this evening. It will still be on YouTube, so you can, if you didn't get to see everything, then you will be able to follow or to watch again the 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 live that we had this evening. Again, thank you for joining us this evening. Just to let you also know that the Pharmacy Week recognition and celebration continues at Gateway Pharmacy. And we close the week off with a gospel concert here at Gateway Pharmacy in the parking lot. Jehovah Rapha, God my healer. As pharmacists, we provide healing through medication, but we also don't want to forget the spiritual side of healing. So we invite some of the most famous gospel artists in Jamaica at the moment. So we have John Mark Wigan, we have Fabian Wright, we have Kira Sales, we have Treasure Trishawn and Trezeguet, and we have Demario McDowell also. So don't miss out on it. We start at 7 p.m. for the gospel concert. Tickets, just a contribution of $1,000, and just come and enjoy the night with us. And I am sure you will be glad that you were there. So again, thank you very much again. Thank you, Paul, for coming out to have this discussion with us this evening. You will hear more about our patient education sessions in the future, and not only just for Pharmacy Week, but each month we will be engaged like this to give you information that will make you a better patient. Thank you again very much. Thank you, Paul. Thank you, everyone who has been a part of the Zoom this evening. Have a good evening.